We've always talked about the health of the community being one of the most important things in public health. But before the county health rankings, we didn't really have a standard way to measure that. So it was a good idea and concept, but what we've been able to do is put that concept into practice by actually having real measures that can be rolled out for every county in the nation.
I told our Board of Health, I said, this is either going to be a blessing or a curse for us. We did not fare very well in the rankings.
Tacos or nachos? Huh?
Okay, so what we're gonna do to start, because we do have some new people too, so let's say your name and your child's name, and then what they've done since the last meeting.
I'm Sierra, I'm 18, and I'm 2.5 months pregnant.
I'm Nikki. My son's name is Eli. He's 11 months old, and he started walking about 5 days ago.
Our model for the health factors that influence the health outcomes gives a great weight to the social and economic factors. In fact, it's the most important foundation for a healthy community. 40% of the health factor weight is reflected by the social and economic conditions. Changing those are very difficult.
In Michigan especially, we're facing these really tough economic times.
The lack of jobs is just devastating to our community, and people are, fighting competitively for a job at McDonald's.
The unemployment rate affects so many of the others. It affects the children in poverty. It could affect the adult smoking. It could affect, the drinking rates and things like that, which then lead to the motor vehicle accident. We've got to at some point attack the poverty levels and just bring it to the forefront to say, these are a main concern.
There can be such an overwhelming challenge in some communities to think about how can you possibly address the fundamental causes of poor health.
County health rankings, it's our before picture. It's our baseline data. Now we've got our starting point. Now we know where we need to make an improvement. And so we said, let's get the summit together and bring together the stakeholders and let them know what the data says and show them what the rankings indicate. And then really do make it our call to action.
As a DHS worker, what do you feel are the biggest health concerns of citizens you see on a daily basis?
Well, I think because I work with a lot of
It's been really encouraging for me to see the media actually become a partner with public health by calling attention to this issue and by putting the county health rankings on the front page. The community members have come to the table.
It was great to see how many people were appalled by the rankings that we had and the people that wanted to make a change and wanted to get involved.
I don't believe it's a surprise to anyone now to know that in Michigan, Clare was ranked as the most unhealthiest county in our state, and that's why we held our public health summit on March 10th, and today is the next step in that what are we going to do about it phase. We're going to pick your brains, and then we're going to hopefully have you all go back out into your communities and move the process forward.
I think we need to have some legislative people involved because there's an awful lot of things that need to be legislated to help some of the processes.
The Collaborative Council doesn't really have the funding sources to make things happen.
We are trying to find out how to access the new healthcare reform dollars to utilize the rankings and the data that shows in there for grant opportunities, other applications that may come down from a variety of funding sources.
There's going to be a need for some short-run solutions, but the investments that a lot of communities need to make are in the fundamental community structure.
Okay, disciplining your child. And remember that kids learn by watching adults, particularly their parents. Especially in Clare County, we have a really high rate of substance abuse and domestic violence and mental health issues. And so unless someone steps in to help these parents and give them support and break the cycles, then it's just going to continue. How many of you at some point since you have either been pregnant or a parent have been considered homeless? Okay.
I was couch hopping
Yep, right after I had my son, and it was scary, but there was nothing I could do about it.
If people in a community are hopeless about the future, they're going to be much more likely to take risks. These are fundamental problems in communities that need to be addressed upstream at the source of the problem.
Hi.
Charlie, can you give it to Betsy?
So you guys doing okay with food and your budgeting and all that kind of stuff going all right?
Betsy helped me budget on paying my bills and, if I needed any clothes or diapers for Charlie or for myself. And, she talked to me when I need to talk. She's the one who took me up to the school and got me enrolled back in school so I can finish my high school diploma.
Jaylyn Marie Jones.
If we don't do anything, then people will continue to be unhealthy. They'll continue to have higher than average teen pregnancy rates, higher than average adult smoking rates, and obesity rates. And we really just need to say a time out and let's do something about this.